Probably go ahead and get started. We'll continue to let people in as they come in. Good morning, everyone. Thank you for joining the fourth session of our 2024 Joint Cal and Sol Board of Governors exam prep. This week, we have Healthcare Technology and Information Management, which is roughly 8% of the test, as well as Human Resources, which is roughly 12% of the test. Couple updates to relay. There will be a SurveyMonkey that gets released at the end of the series. So again, our series last day is going to be 6/1, so 2 weeks from today. We will send out that SurveyMonkey, so please keep an eye out. The 8 units that you receive from here, you can self-report again on my ACHE profile. If you have any questions about that, please reach out to us. We will be turning in everything to ACHE. They're aware that we're conducting this, so they'll gladly accept those 8 continuing education units for this. And just a reminder again, there will not be a session held next Saturday, 5/25. We know it's a holiday weekend. We want everyone to enjoy that. We'll regroup on 6/1 and do our final session. All right, Mary, I'll send it over to you really quick.
Take myself off mute. I am introducing Ryan. He is the main coordinator for this this committee and these sessions. But in his day job, he's administrator for Contra Costa Health, Public Health. He is EPIC certified, and he has 10 years of operational leadership with high data and systems analysis component. We are so lucky to have Ryan helping coordinate, overseeing this program, and to be your presenter today. So take it away, Ryan.
Thank you, Mary. So I won't go too much into these slides. We did send these out. I do know that IT is not everyone's forte. When I started in healthcare, I've been in healthcare for about 17 years now. I was horrible with IT. The only thing I could really do was barely use my email, and I knew how to use Microsoft Word. But working in healthcare, you quickly become accustomed to a lot of different technology. So don't feel like you have to be an expert in any particular thing, whatever you do in your day job, whether it's dealing with data for your department. Mary and I were talking before this about having to do payroll, having to use that system. IT component of the exam is really looking at all of those different areas that you would interact with as a manager. So I think we can go on to the actual questions and get started. So go ahead and take a minute to read through this and take a look at the answers, and feel free to post in the chat, and then we'll kind of walk through these questions together. But I'll give you a second to read through each question first.
Yeah, remember, lots of words. Be really careful.
So a CMS program that requires provider to consult a qualified clinical decision support system for the appropriateness of a diagnostic imaging services is called. So I think the keyword that pops out at me right away is CMS. So I know it's something to do with Medicare, most likely. I'm aware of clinical decision support mechanisms just because of working on the inpatient side. So those help me. And then imaging services, so an X-ray, an MRI, the appropriateness of a physician basically ordering that is what I'm getting. But what is the program that kind of stipulates whether it's appropriate for Medicare? So A, Health Information Technology for Economic and Clinical Health Act. So high tech. High tech was more more about, adopting and utilizing technology. It wasn't so much stipulating whether something was appropriate to use for an insurance matter. So I don't necessarily think it would be high tech. Protecting Access to Medicare Act of 2014. Well, Medicare, CMS, that's a big connection right there, but is that too simple? Am I automatically gravitating to that because CMS made me think of Medicare? To be honest, I'm not really even sure what the Protecting Access to Medicare Act, it sounds familiar, but I don't necessarily remember it. Meaningful use. So that's basically a term that, we use within healthcare about utilizing technology, utilizing it appropriately, utilizing it effectively. So that's more of a term. That's not necessarily a program that's out there. American Recovery and Reinvestment Act of 2009. So I think high tech was actually a part of that. But if I remember correctly, the American Recovery and Reinvestment Act was not healthcare specific. I think it was for a lot of different divisions within the country, a lot of different areas. It wasn't specific to healthcare. It just had, components for the healthcare industry. So I don't think D would be the right answer. Meaningful use, definitely, I don't think that meaningful use is just a term. It's not a program, so that would automatically be crossed off my list. High tech, again, I think was just about adopting it. It wasn't about putting in place stipulations for how to use IT. So I'm leaning more towards B. I'm not fully, I mean, it sounds familiar, but I'm not overly familiar with the act. But especially since I was already gravitating towards something Medicare, because of CMS, I'm looking at B. I was able to weed out C and D. The only question I have is about A, whether high tech really did have something, but I don't think it did. So, I mean, I'm gravitating towards B. And if I look in the chat, yeah, it looks like everyone's kind of thinking B as well. Let's go ahead and look at the answer. So it was B.
Great job, Ryan.
Oh, go ahead.
Well, you picked out a really good clue here that what the high tech means, and that it was a part of the American Recovery and Reinvestment Act. So you were able to eliminate two of those on one of the flashcards. And again, knowing the meaning of knowing that those two were together, and then knowing what meaningful use means, help eliminate those. And you did a really good job of describing that.
Thank you. Does anybody actually know what the Protecting Access to Medicare Act was?
And you'd think I'd remember these answers, but I really don't. Oh, and so I'm using the information systems book recommended by ACHE, part of the study bundle. And I will look it up.
Yeah, I'm just curious because it sounds familiar, but there are so many different acts that we're going through when technology was being adapted. I don't fully remember them all. I just remember high tech and the time that it came out, because there was that big push to adopt technology, and they were offering, training programs for anyone that was interested in helping with that.
I'm not seeing a definition in here, but I'll look for it and get back to you guys.
Okay. Well, let's go on to the next question. Just go ahead and take a moment, read over this one, and then I'll jump into this and go through it as well. The COVID-19 pandemic played a significant role in the expansion of telehealth with 1135 waiver by. Excuse me. I'm not sure what 1135 waiver is. COVID-19 pandemic and telehealth sound, all too familiar. And I think COVID-19 definitely kind of pushed telehealth further than it was going at the time. So I think the key word there is waiver. But what type of waiver? See what some of the answers are. Allowing Medicare beneficiaries to receive services in a designated rural area. Well, Medicare should be reaching rural areas regardless of the pandemic, unless they mean that there's a specific place that was designated in each town. Allowing Medicare beneficiaries to receive services at clinics, hospitals, and certain types of medical facilities. Well, that was already in place. That's not because of the pandemic. Encouraging a non-face-to-face communication through online portal services. Well, that is telehealth in some ways, but I mean, I think I remember well before the pandemic that was a big IT thing that they were pushing for, was the ability to email your doctor and be able to log into an app that would allow you to communicate. So I don't think that was necessarily part of the pandemic. I think it just enhanced because of the pandemic. Medicare paying for office, hospital, and other visits through telehealth across the country, including patient's place of residence. So one thing with the pandemic that I do remember was everything kind of went virtual. Different office visits that used to have to be face-to-face suddenly became virtual and were billable. So that definitely sounds like something that the pandemic would have helped with. I'm just still confused by the 1135 waiver because I'm not sure what that is. But Medicare paying for those services sounds like something that a waiver would have been put in place for. Going back to A and B, I think those were already in place. Those aren't something that the pandemic or a waiver would have been in place for. But I think the non-face-to-face in C is kind of calling to me because of the pandemic and telehealth, but then also D includes telehealth. So it's those keywords looking at, looking in the chat, everyone's kind of saying D. I was kind of leading towards D. I was just trying to figure out how to weed out C. And I think, just based on my own experience, talking to my own physicians before the pandemic and seeing what was going on in the healthcare world with communication to physicians, I think non-face-to-face communication was already kind of in place and it wasn't something you would need a waiver for. So yeah, I think I would go with D on this one. And it looks like, oh, that looks like there's a hand raised. Deborah, do you have a question?
Yeah, no, just a comment. Here is how I would approach this. So allowing Medicare beneficiaries to receive services in designated rural areas is already covered. That's your critical access.
Yeah.
Allowing Medicare beneficiaries to receive services, clinics, and hospitals, that's already in place. Encouraging non-face-to-face communication through online portals. Well, non-face-to-face means why you on an online portal if you're not seeing them? That's telephone. So D, because we never had any place that would reimburse for telehealth medicine. So when a visit occurred, there was nothing in place that then you could bill Medicare for that reimbursement. So by process of elimination, I went with D.
Yeah, I think that's a great point. And I think even if you don't know the waiver piece, just knowing that those weren't covered prior to the pandemic would kind of lead you more towards that, the answer for D. So let's see what it is. You're right, it is D. But yeah, I think A and B automatically, those were already things that were in place. And C was already something that was kind of going on before the pandemic, with just being able to reach out to providers without having to go to the office. But the biggest piece was they weren't covering those telehealth visits before the pandemic. Any other questions on this particular question, or any other thoughts?
I thought that was a pretty good breakdown of how to get there.
Yeah. Let's check out.
Particularly knowing that the history of where it already was helped eliminate quite a few of those.
Yeah, I think that's the biggest thing, is knowing, you know, that a lot changed, as we all know, after the pandemic, even in the way we operate managerially, meetings and everything. So there's a lot that changed insurance wise as well. But question number 3, go ahead and read over it, and then we'll dig into this one. So why is it important for the IT strategy to align with an organization's goals and objectives? So basically, what the organization's trying to achieve, either in the long term or short term, why is it important to align the IT strategies to those goals and objectives? That's how I read that. To increase Medicare payments. I think there's a lot more than IT that would need to align in order to increase the payments from Medicare. I don't think that's necessarily an IT thing. To improve access to data for management, providers, and consumers. Well, I know there's a big push to get readily available data for everyone, and especially if that's an organizational goal, which it is for a lot of organizations within healthcare. It would be important to design an IT strategy, I would think, that would be able to develop that either through new IT systems that would allow easier access, or to prioritize analyzing that data, to allow the CEO to control IT spending. I would think the CEO would not necessarily be trying to align IT strategy so that he could control it. I would think that that would already kind of be in place with what the goals would be. To give the CIO a seat on the executive committee. I mean, to me, C and D just kind of seem like fillers. They don't seem like something that really would play a part in IT strategy. I don't really think that IT alone could increase Medicare payments. I do know that there's a big push for data. I've actually, been in a lot of roles where I'm pulling the data and know that it's, wanting to have something that's an IT system to be able to pull that easier is something that I've experienced, and I know a lot of organizations are pushing for. So I would lean towards B with this question. It looks like everyone in the chat's agreeing. Let's see what it is. And it's B. Yeah, I think to me, C and D are kind of, maybe it's just the way they're written, but I think they're kind of filler answers to either be able to quickly push it away or make you think that when they're talking about strategy, they're talking about involving IT more in executive decision making, but that should be something that's kind of already in place. So I think those two are kind of fillers, in my opinion. Let's go on to the next one. What competencies do not matter in selecting a CIO? So if we're going to read this one backwards a little bit, when selecting a CIO, what competencies do not matter? So you're looking for the answer that is true. You're looking for what doesn't matter. All the other ones that are in there should be ones that would matter. So prior management experience. Well, anyone that's in a C-suite position, you would hope would have prior management experience. So that one is definitely one that would matter. Knowledge of the healthcare organization and delivery. So I can see where that might be tricky, just because we're talking about a CIO, we're talking about information technology, but you would still want somebody in that role who's aware of the healthcare side of IT, or the healthcare IT side, not just information technology. You'd want them to know about the organization and delivery. So I think I can weed that one out pretty quickly. Personal relationship with a board member. That might help them get the job and or the interview at least, but I don't think that's a competency that you would necessarily want unless you're talking about somebody being comfortable and knowing they can do the job, but that doesn't seem like something that would be an essential piece. Finance and budgeting skills. So again, I think, somebody who's in that level of management, you would kind of want them to have at least some financial skills. So I can weed that one out. I mean, I think looking at this as a whole, A, B, and D are definitely what you would want to have somebody who's in any kind of management experience within, or managerial role within healthcare. You'd want them to have some of that knowledge. You don't need them to have a competency of being known by a board member per se. So I would say C. Looks like all of you agree with that. Let's see and C it is. I think this one is kind of one of those questions that seems way too easy. So you might overthink it, but I mean, just looking at it, you can easily see what is a competency that would be expected in somebody at a leadership level, and what wouldn't be. Deborah, do you have a question?
No question, just the comment in that I put it in the chat that C is not even a competency, that's a relationship.
True. And there are questions on the exam like this that seem too good to be true. They're too easy. So don't feel like you're rushing and that don't overthink it, basically, is what I'm trying to say. If it's that easy and it's that clear, there are questions like that. So you can kind of easily weed this one through and move forward.
The reason we left that one in, I mean, we have a reason for all these questions, is again, like Ryan pointed out right away, you've got to read it and see what does not matter. And if you're not careful and don't read it backwards, you could just literally skip right over that and say, what matters? And you're like, wait, there's more than one answer.
Yeah, that's the big thing, is making sure you read that point. What is not a competency? And it's easy to do with shorter questions like that, I think. It's just kind of
Yeah.
reading it too quickly.
I'm guilty of that daily.
I think we all are. All right, question 5. When introducing a new information technology system to a healthcare organization, resistance can be effectively addressed by. So you're introducing, I mean, I think, having worked in operations and briefly in IT, there's a lot of similarities when you're introducing technology in a lot of ways as a workflow. When you're introducing something new, there's always going to be resistance. And you deal with it in a similar way, I would say. So with this, we're introducing a new technology system. So eliminating existing social groups that appear within the organization. You're never really going to be able to do that. There's always going to be social groups. There's always going to be different cliques within a department or an organization. So if you're introducing an IT system, you're not going to necessarily be able to avoid resistance by eliminating those social groups. You might be able to disrupt them a little, but I wouldn't say that's an effective way. Employing a policy of mandated use throughout the organization. So that's kind of forcing the system adoption. I would say that would be more of a last resort if you're having that much resistance. I don't think it would be an effective way to address it. Focusing on the system's users and being responsive to their needs. So going back to my thought on this question, as somebody who's worked in IT and operations, with any sort of change management, you always want to focus on the stakeholders. Even with project management, that's kind of the key, is you want to focus in on the people who are using the system or people who are going to be impacted. And I think, giving them the floor, giving them the ability to interact with you and ask questions and be clear on things can help with, moving things through. So I like that answer. Rapidly introducing the system changes to allow the staff to see the cost savings. I've been guilty of trying to rapidly introduce things in my career. It never really goes very well. You kind of have to, go through the steps to introduce things. And I know that staff aren't always concerned with the cost savings unless it directly impacts them. If they're going to get bonuses, raises, there's not going to be layoffs of some kind, then they might be concerned about cost savings. But I don't think pushing something through and then showing them the cost savings is going to effectively address the resistance. Definitely A is not something that would do it. B, I could see more on an authoritarian level of saying this is what's going to happen. But that's not going to effectively address the resistance. It's going to probably make it worse for a while until it just subsides. I think that's one of the biggest things I've learned, is, getting stakeholder involved in what you're doing to make sure that they're on board with it, whether they're an early adopter or a late adopter. So I think C, in my opinion, to be the best one for trying to effectively address as much of the resistance as possible. Yeah, it looks like everyone in the comments agrees. So let's see. And let's see. I think, that's a lot of ways that's basic change management, whether you're in IT or any other department. When you're implementing something new, you've got to get buy-in as much as possible, and you've got to kind of prepare and address some of the issues that are there before go live, making sure that people are heard and understood. The best way to facilitate information system integration within a healthcare organization is to... So when I see integration, it always makes me think interface. So that's a key word for me. Centralize all computer activities. Not really sure what's meant by that. Use computer equipment from only one manufacturer. I don't think I've ever worked in an organization where only one manufacturer was supplying something. I've had different computers next to each other, different keyboard vendors. So that's not something that would necessarily help, or is even something that goes on. Use computer software from only one vendor. So there isn't necessarily a universal vendor that does everything. You always have different software vendors, different programs that feed into each other, so that integration or interface. So that's not something that's really plausible. Standardize data definitions and data structures. So when I think interface, that's exactly what I think of, is you want to make sure that these two systems align and that they're speaking the same language, basically. So in my opinion, that would be the best way to facilitate integration. And I'm able to, B and C, they're easy to cross out, but I'm still not sure what the centralize all computer activities is implying. But I don't know if that's even something that would be possible with, especially with bigger organizations. So I think that's the biggest key right there, is system integration, talking about systems, talking to each other, being able to feed into one another. And the best way to do that I know of is through making sure that the data aligns and is built similarly so that it crosses over effectively. So I would go with D, but let's see what, yeah, looks like people in the chat agree. So let's see what this is. It's D. And I think for me, that keyword integration kind of really helped spell it out for me, because I knew that it was about systems interfacing with each other. So trying to look for the best way for that to be successful.
Okay, lots of words, lots of words.
Yeah.
Red alert.
So knowledge management is defined as, so knowledge management from an IT perspective, I'm thinking of like a repository or that sort of thing. The practice of explicitly and deliberately building, renewing, and applying relevant intellectual assets to maximize organizational effectiveness. That sounds like a great definition, but is it the definition of knowledge management? Especially if you don't necessarily know what knowledge management is. Let's keep reading. The transfer of structured information between two computer systems. Well, we just went over a question that dealt with that. That wasn't knowledge management, that was integration. So I can eliminate that one. A movement to explicitly use the current best available scientific evidence for managerial decision-making. Sounds like evidence-based decision-making, which can be derived from knowledge management, but I don't think that's the definition of knowledge management. The planning, organizing, directing, controlling of resources to accomplish goals and objectives related to a distinct initiative. Well, that sounds like operations. That sounds like carrying out organizational operations to me. It's not necessarily knowledge management. You might get information you need to help with that from knowledge management, though. So B, I definitely don't think would be the answer. I like A just because of, I'd originally thought, you know, a repository of information, and it relates to that. But best available scientific evidence for managerial decision-making, it says explicitly use the current. So would that be knowledge management? I don't think that would be knowledge management. That might be how you gain information from knowledge management. And I think D is kind of how you carry out what you get from knowledge management. Yeah, I like A as the definition just because I'm thinking of a, you know, repository that you continually update, and that kind of breaks it down into that. It looks like we have a couple different answers in the chat. So it looks like we have A and D are the two main ones that everyone's looking at. So if I look at D again, the planning, organizing, directing, and controlling of resources. So that word resources calls out to me because we're talking about resources in terms of knowledge, or are we talking about resources in terms of staff? Because I mean, controlling may not be the best word, but directing, managing staff to accomplish goals. Because in the end of the day, people are the ones accomplishing the goals through the planning and directing of everything. So D to me it seems more like operational planning, how you're going to achieve the goals, what you're going to utilize. Intellectual assets leads me to knowledge management. That is a good keyword. I like that in A. So if we look back at A, the practice of explicitly and deliberately building, renewing, and applying relevant intellectual assets to maximize organizational effectiveness. Yeah, I think A describes knowledge management more simply because it's talking about the repository you would gain this information from, whereas D's talking about what you're going to do with it once you have that information, once you have the knowledge of how to carry it out. You know, you're planning to use it, you're directing it, you're directing your staff based on that knowledge. So yeah, I would go with A.
So there is a flashcard for this, and I found it really hard to read the definition here and translate it to there, but you did a really good job. The definition is efficient handling of information and resources contained in the electronic health record in the data warehouse of protocols and processes that guide patient care delivery and from the literature and internet. So taking all of that and breaking it down the way you did it, that, yeah, A fits that one the most. But this one would have messed me up really bad.
Well, D is a very good explanation as well. That could be, I can see why everyone was looking at D, because I was looking at D too, but I think the biggest part, although you did say resources in the flashcard,
I know, see, that,
resources was kind of confusing me because I'm like, are we talking about resources in terms of the systems you have available? Are we talking about resources and the talent you have with your staff? Knowledge management isn't necessarily about carrying out those
well, at least,
objectives. It's
I'm sorry to interrupt, at least we eliminated B and C,
yeah,
right? There is that.
it did help that we had a question related to B, so I was easily able to weed that one out. But on the exam, you do have that where one of the other questions may help you with the question you're looking at. So that's one thing to remember. There are some that are related, and you can kind of weed out answers based on that.
Right, and like Tara says, intellectual assets there, yeah. This was a good one.
So it was a good one. So it was a real thinker.
And Kimberly just put it in there. How I approach this question to get A, B and C really are cross them out. But the difference between A and D is the end of that sentence, to a distinct initiative or to maximize operational effectiveness. And you want to go with your knowledge management for the largest or the biggest goal of the organization, not just a distinct initiative.
And that's a great point that I missed on there. That last part of D, distinct initiative, does narrow it down quite a bit. Whereas knowledge management is something that's a lot broader. So that's a great point. Thank you, Deborah and Kimberly.
This is why we do this with live participants. Exactly this reason. Thank you.
Which of the following is a reason that system support of outcomes data collection and analysis can be very complex? So as somebody who in almost every leadership role I've had, I've also played the data collector and organizer and presenter. I'm all too familiar with how complex it can be. And there's a lot of different reasons, but it's looking for the following is a reason that system support of outcomes data collection. So the systems themselves of how they're collected and analyzed. The required data typically resides in multiple information systems and in manual systems. Well, I've run into that problem again as somebody used to analyze data, having to pull it out of different systems, having to display it somehow, and having to also pull manual data or manual information that's outside of a system. So I know that can add to complexity. The functional departments are not integrated with financial informational systems. I don't know if that's true, but I also don't know if that's an essential reason that would make it complex. There's an inconsistent medical terminology across different clinical systems. Well, again, going back to integration, interfacing, one of the biggest goals is to try and standardize those definitions. So that to me would be something that would be an easy fix to reduce that complexity, but it also shouldn't really be something that exists because, integrating systems is one of the key components of IT. So you would want to make sure that that's not a barrier. So I don't think that would necessarily be a part of it. Variation exists between open systems architecture, interface engines, and multimedia data entry options. That was a lot of words, and that was kind of confusing. I mean, even for somebody who's kind of techie in a lot of ways like me, I don't know that I understand that answer as much.
Well, I believe that is probably true, but whether it's the most correct answer is another story.
And I also think that that's something that, again, kind of with B and C is something that you could correct from an organizational perspective. If, you know, your functional department isn't integrating properly with the financial informational system, that's something you could work on. The medical terminology is something you want to standardize when you're interfacing systems anyway. That's what your IT department should be working on. And then if there's variation between all these other systems, that's something that they should also be looking to work on. So when they're saying multimedia data entry options, I'm thinking of whatever you enter into the health record per se. So you can change that to make it less complex. I think the biggest thing that you can't really change necessarily is that there's a lot of different informational systems within an organization that you have to pull data out of, and there's not always a central way to do that that pulls it from all the different places. And there are, in a lot of ways, still a lot of manual processes, even within healthcare. So I would gravitate towards A. And it looks like A and D are kind of the ones that everyone's, again, kind of looking at. So with the variation piece, I think what gets me is that's something that should be fixable. Like, it shouldn't add to the complexity. If it's something that is adding, there should be a way to fix that. Either don't use certain systems, improve the interface, improve the data entry fields. So I wouldn't think that would be an ongoing barrier. It might just be something that pops up, but I know that multiple informational systems exist and they don't go anywhere, unfortunately. There isn't that one central system that can do it all. So I would go with A. It looks like A is kind of taken over. Let's see. Yeah, so it is A. So I think that was, oh, go ahead.
No, go ahead.
Oh, no, I was just going to say, I think, you know, that was one of the things I could rely on my past experience with that I've had that's made it more complex, is having to pull outcomes data out of multiple systems, having to ask for manual tabulation data that I have to then translate. So, I mean, I think that helped me with this, but if you're not somebody that's had to deal with that, I think looking at what you think you can fix to make it less complex, because I think all of these answers could make it complex. But yeah, I think just being able to weed those out. Yeah.
Yeah, it's like the others fall through, you know, are pieces of that, but it's the broadest.
Okay. Do we have time for one more, or should we move on to?
I believe we should move on to HR.
I had one comment on this, if you don't mind.
Sure.
Even if you didn't have the experience and you go back to the question, you are actually looking for outcome data collection and analysis. So you're really looking to get information out, not how you get information in, which D actually talks about how you get information in. So just by, again, here, elimination, because I think we all agree that B and C were the distractors, and we really needed to decide between A and D. A is saying, how am I getting the information out? And these are the barriers to getting the information out.
That's a great point. You're looking at extraction and not entering it in.
So yeah, this is why we love the participation. Again, we don't pretend to know everything or look at it the same way, but the value in having all of you explain how you got to that is great. Or how we go through a rabbit hole, which I do all the time.
All right, well, let's move on to HR. So with this, we have our committee member, Grace Sinclair, who will be presenting HR. Really glad to have you here, Grace. So Grace has over 15 years of experience in compliance. She is a professor at Cal State East Bay, teaching in the MSHCA program, and she's also a current law student. So really happy to have you here, Grace.
Thank you. Really happy to be here with everybody. So human resources, we'll be going over that. First, I'd like to say I've never worked in human resources, but as with everybody's, depending on their role, I know that you always touch something within human resources. And I know that working in compliance, I continuously am always reaching out to human resources or vice versa. Just on various topics. So working closely with HR has been a really big thing that I've done in compliance. So here are some of the information, and I guess we'll jump right into the questions. So I will let you guys, we'll do kind of what Ryan did and let you guys read the question for a couple seconds, and then we will go through it.
And remember, this is not California specific or any state specific. So this is like the universe of HR.
Right. So which of the following is typically performed during a background check? So when I'm looking at this, of course, performed background check, I look at those keywords. Looking at verification of personal finances. For this one, I would think not, unless maybe you were going for a CFO role, but not in general. Involvement in religious or political activities. I think this one also I would look at it and say, it doesn't look like something that they would be looking at in a background check. Previous employment or education claims. This one stands out to me just because usually when they do a background check, they're looking at your employment. They may possibly ask for transcripts depending on what role that you are looking at. And then prior performance evaluations. Possibly, but I've actually never had anybody ask for my performance evaluation. So I would look at this, and I just kind of looking at all of these, I would gear more towards C, previous employment or education claims. And it looks like a lot of people are answering C in the chat. So let's see. Okay, good.
I actually did have somebody ask for a prior performance evaluation one time.
Oh, you did? You did?
I automatically stopped with the application process. It kind of turned me off.
Yeah.
So, I mean, they can, reach out to your organization, everything.
Yeah, that's true. And it's funny, I always save my performance evaluations just in case, but yes, I've never. So that's interesting that you did.
Well, those are also very, subjective, can be subjective. I mean, I've always had decent performance evaluations, so it's not like I was afraid to send them anything. It was more like just kind of turned me off to the organization, I think.
Yeah. All right, number 2. Let you guys read that one for a second. Okay, so the primary purpose of a well-developed performance appraisal system is to, first one is compare employees across the organization. So, well, first, I guess I would look at the keyword here for me with primary purpose. So what's the primary purpose of this? So compare employees across the organization. I would think that they shouldn't be doing that. Also, for B, provide employees with developmental feedback and guidance. I think that's really important. I think feedback is huge, guidance. So I think that would be really strong for a performance appraisal system. C, ensure employees understand the job they are supposed to be doing. I think that's important too. I think every employee should know what they're doing and should understand what their role is. But I'm still looking back at the feedback. I think the word feedback in B is sticking out to me. And then D, determine how well management engages employees. When I look at that, I know a lot of companies have done surveys, and so I don't know if it would be something for under performance appraisal. I think that would fall more under some type of survey that they may do. So just kind of looking back at these, I think feedback and guidance really stick out to me. And I know in the chat, there's a couple different answers. There's some B's and some C's, I believe I saw. But yeah, I think I would go with B. So let's see what the answer is. Okay. Oh, good. All right, so the next one, let you guys read it quickly. So I'll go ahead and read it. With growing frequency, employees who have been dismissed are resorting to lawsuits for redress. In such cases, the court may find in favor of the plaintiff if the employer dismissed that plaintiff. So this is taking me to what I'm learning in law school right now. But I'm going to look at growing frequency, lawsuits for redress. I'm just picking out some keywords that I'm looking at. So if we go with the answers, let's see. So for cause, but without using progressive discipline. I'm not sure about that one. Without cause. That one kind of sticks out to me a little bit. Before the end of the plaintiff's probationary period. Possibly. For union organizing activities. So I'll look at the question again. And I know we were saying this is in general, all, different states have different rules. When it comes to these types of lawsuits, but I think I'm looking at without cause. Sounds like what I would go with. So. Sorry, I'm going to pull up the chat because I can't really see what's going on in the chat. Okay. So we got some D's in there. For union. Let's see. And some B's. I think I'm going to go with B, without cause. So let's see. All right. So let's go to the next one. Okay. Let you guys read that for a moment. Okay, so which of the following would be considered the most effective approach to preventing the need for employee disciplinary action? So effective is one of the words that sticks out. And then of course, preventing any disciplinary action. So if we look at A, I think it's really important to have a accurate job description. I know in almost every position I've had, you get that job description and you sign off on it at time of hire. So I think that's really important. Having an employee orientation program, that's important too. For every employee, I think that's really beneficial, but I don't know if it would be the best in terms of an effective approach. Implementing a performance-based compensation system. Don't see how that would really tie into this one. Giving managers a small span of control. I don't. Looking at that one. I think that would work.
We're getting A's and B's.
Yes. So I think that I would look at the accurate job description. A. Yes, and I see that somebody said, or your Lean, you said setting standards promote accountability. Yes, I agree with that. I think that's important. Okay, moving on to the next.
In the question, one of the things you guys have taught us to look out for, it says the most, if you go back and look at it.
See,
The
we've been
most
successful
effective
already.
approach.
Yeah, that's true. That's true. That's
Good point. Thank you.
thank you. All right. So this one is, which activity should precede the beginning of a recruitment process for a new employee? So I'm going to look at the question again. So what should precede the beginning process? So if we look at A is obtaining information from the employees in a similar position to assess the validity of the job description. I'm not sure about that one. Let's see, the second one is assessing the cost of various forms of recruitment. This one is it doesn't stand out to me as much. Making a decision whether to emphasize internal or external recruitment. I think that's important to see what they're going to do, but I'm not sure if that should precede the beginning of the process. And then conducting a job analysis. I think that's really important to look at the job analysis.
We've got some D's.
D's. Okay. So looking at this, I'd either look at C or D would probably be the ones I would choose first, because I don't think that mean, I think the cost is important for the forms of recruitment, but I don't think that should be the beginning of the process. And then A, obtaining information from employees in a similar position. I think that's good to look at, but again, I don't think it's the beginning of it. So I would be more to say, and I think a lot of people are saying D. I would go with the D. Good, good. All right, moving on to the next one. This question is, the evaluation of senior management is best administered. So that word is best, I think, sticks out. So look at some of the answers here. So when criteria are established and known to both parties, I think that's really important. I think everybody should be aware of what their criteria is. On a scheduled periodic basis. It could be, but I'm not sure if that would fall under the best. After consultation with the executive committee of the board. Not sure about that. In conjunction with a salary adjustment. And I think that's anytime there is a salary adjustment, I think that there should be an evaluation, but I don't know if that's the best. The word criteria is sticking out to me. So I think that, and it looks like a lot of people are going with A. I see a couple of B. But I think, yeah, I would say the word, yeah, I think criteria is really important. And and establish it with both parties. So I would go with A. And it is A.
So there's one great big distractor here when they're talking of the evaluation of senior management. This could be the evaluation of anyone. So,
That's true.
and so then they throw the executive committee in there, and it's like, wait, that's only like the CEO, right? But so that's the distractor. So even though it's just a few words, don't let it distract you.
No, that's a good point. A very good point. All right, moving along. I'll let you guys read that for a second. All right, so the critical incidence technique of employee performance appraisal requires raters to. So some of these words, critical incident. Requires raters, kind of sticks out to me. So what is required? So I'm going to look at these answers. So A is select statements that fit the performance characteristics of individuals. Looking back at the question, could the critical incidence technique of employee performance appraisal. So I'm not sure about A. B, select the highest and lowest performing employee in a work unit. I wouldn't go with that one. I don't know why. Looking at the highest and lowest performing would kind of fit in there. Record the degree to which specified behaviors are performed. Not sure about that one. Record behaviors of employees that are related to both good and poor performance. I can see that. You want to look at some of those behaviors. possibly to have as, example of what you want. I'm just looking at these to see if anything kind of sticks out. This one is, we got there's a D in there. Let's see. Say this one's a tough one for myself. But
This one, I hate this one. I hate
yeah.
it. I get it wrong every time.
Yeah.
And I should remember.
Yeah. I know we got a couple D's in there. What about all these? So I'm going to go with kind of what everyone, what we have in our chat. And I know a few have been saying D, so we will go with D. And it is D. Okay.
So this is critical to know the definitions like of the different appraisal systems. And I don't know if I'd held this one yet, that there is an HR book in this study bundle. And the distractor here is, for me, it's always been when they talk about a rater and then you're rating the selecting the highest and lowest. You know, that one gets me screwed up every time.
Yeah. This one I had to keep looking at it for a little bit. So
yeah, we trust the participants.
yes,
Guys are on a roll.
but they are. All right, going to our last question. All right, so I'll let you guys read it for a second. Okay, so according to Herzberg's hygiene and motivators theory of motivation. Okay, so I need to go back and look at what Herzberg's hygiene and motivators theory is, but thinking about we're going through HR, I don't know if it really would pertain to hygiene. I think that's something to do with something within HR. So looking at A, cleanliness of the workplace plays an important role in motivation. I think so, but I don't know if this would be that theory. Even though I know that's important to have cleanliness. The next one is the absence of adequate compensation can be a dissatisfier, but the presence of adequate compensation is not a motivator. Okay. That one's interesting too. I think that's important. And C is employees are motivated by money and factors intrinsic to the job itself. I'd say yes, I think they are motivated by money, but I think there's other factors that play into it as well, which can be feedback, recognition. All those I think are really important as well. Extrinsic factors are prime motivators. Sure. So we have some B's and some D's or C's. I always look at the long answers, but then I also kind of look, so B is probably the one that I'm looking at, because I think it is true that when there's not adequate compensation, it can, dissatisfy an individual and maybe not motivate them. But then it also says, but the presence of adequate compensation is not a motivator as well. So I think motivating an employee takes a lot, not just, like I said, not just compensation. So a lot of people are saying it looks like B. I would go with B. So let's see if then.
Good job.
Yeah.
And it's me. Okay.
And again, you know, I always got this one wrong until the simple answer is compensation is not the prime motivator.
Yeah.
Um,
Nice. It's nice, but it's, yeah, there's so much
Yeah.
more that you would
But
want.
I had forgotten all this, you know, the hygiene and motivators theory of motivation.
Mhm.
And you know, the distractor in there. Yeah, hygiene, cleanliness, sure, but yeah, no.
Yeah, exactly. All right. Well, that is all for, that's the last one, right? We have 8.
Yeah, that was the
Yes.
last one for HR.
Okay. Okay. All right. That is all.
So reading everyone's, you know, notes and hearing explanations for the participants is golden. So again, we really appreciate this. This one's a tough one. This is a tough section. But again, we've got this book and there is a big section in the flashcards as well.
And it's interesting to see, you know, everyone's different way of looking at it and catching certain words that, you know, you may not catch. I think that's really helpful. And it's great that we've had this participation today. Because there are a lot of keywords, and like Nora, you're always saying, a lot of words. Read through it. You may not catch something unless you read it a few times. So um, always read through it a couple times if you're confused.
And again, this is one of those, like with finance, you do have to know definitions. You know, in finance, you need to know formulas. Here, you don't need so much to know formulas, but to know the names and know the definitions. And again, and eliminate the inappropriate ones. That's the challenge.
Yes, we did email out the slides from last week. I don't know if we had any. I can dig through our files to see if we had any additional quality supplemental questions and send those out with this week as well. If you didn't get that email, Miriam, let me know. I can send all the information to you.
Yeah, we usually throw out some older questions that we've had. And again, literally we're throwing out everything we've got. So, but at least the presentation you sent out, if there were any that were missing, would have been included in that one.
You'll have to look back. I don't know if there's an additional slide deck that was sent out with it. I know there's a lot of finance questions we included. I don't know if there was additional quality, but I can check, and I can always send those out as well.
I won't be able to participate in next week's session, but I will give a qualifier. We do send out at the last session, we send out a really, really old ACHE practice exam with answer key. And it's old. But again, just reading structure and eliminating incorrect answers is the key to why we present that. However, it's not maintained by ACHE anymore. So I just want to put that qualifier out there that ACHE doesn't support it anymore, but it was in use at one time. And we believe that the value is in how to understand the questions, how to interpret the questions. And again, it's got the answer key to it. So again, some of those are really, really old, but we still believe that there's value in taking a look at it.
Any final thoughts for today about the topics or about the series so far that you'd like us to go over? We have a couple minutes. Otherwise, we can end a little bit early this session. I know we went over last session, so give you a little bit of time back.
Thanks to our presenters. You guys did great.
Thank you.
Thank you.
All right, well, have a great weekend, everyone.
Yes. Have a good weekend.